So I need to congratulate you for your wonderful performance and achievement in NEET SS 2020 and for scoring a rank of 40 in cardiothoracic and vascular surgery in the specialty of MCH. And so we want to know
Thank you very
from
much.
Dr. Hitesh now to know from him his brief history of his MBBS graduation and why cardiothoracic and vascular. Are you interested in cardiothoracic or in only in vascular? I mean, what is that you're going to choose?
Actually, to start with, first of all, I can tell my father is a great inspiration for me, sir. He's a pediatrician. So since my childhood days, I used to see him treating patients, and his dedication, his determination over the patients, even night calls he used to attend, and he will take care and saved lot of babies, lot of patients. And the way their bystanders used to come and congratulate him, I thought there is nothing more than this to achieve in life. But I never so slowly. But when I went to like 10th standard, whenever I read something about heart, I used to feel so fascinated that I felt like it's such a wonder organ. So, and like that it continued. I never thought, because that time I felt like becoming a cardiothoracic surgeon at that time itself. But that was just 10th standard. I can't tell anybody that because it is such a prematurely I can't tell. So I was just telling I like MBBS, so I will take medical seat like that. And somehow I got medical seat. In medical seat, I never knew that this cardiothoracic surgery is surgical branch and medicine branch. All those things I never knew actually initially itself. So in medicine, we used to see a lot of cardiac patients like murmurs, valvular disease, and all this CCF, coronary artery disease. But I am not that much so knowledgeable to take medicine medicine branches. I am not that much so much that reading books and all. So I liked surgery branches. So I just asked my father what to do like that. He told, you take surgery, then you can go to cardiothoracic surgery and all. So these all things made. And one more thing I have to.
Where did you do your medicine?
I did my MBBS in WIMS Ballari, sir, Vijayanagara Institute of Medical Science. I mean, Hampi, you may be knowing Hampi in Karnataka. So Vijayanagara Institute of Medical Science, and the same college where my father also did his MBBS in 1972. So like that, the legacy continued, and like this it continued, sir. And then actually feeling the whole body when I take in that, I feel heart as a very whole life. It will give service to us so selflessly, and like that I had so much of interest on heart. And whenever I was in internship and even in MS I did in Medical College Calicut. I am just doing now, finished now SRship. I had seen so many patients with cardiac arrest, brain dead patients. So until and unless the last beat of ventricle is there, we can't say that the patient is died. So heart is the one which, so like this I continued. And most of the time seeing you and talking you is a great pleasure. And I feel so lucky to talk to you as a great cardiothoracic surgeon. So even in this so much of busy schedule, you have created a great institute and helping so many people like us. So like this it started, sir.
How did you come into speed?
Speed actually, first of all, I somehow wanted to take cardiothoracic surgery in the first attempt itself, immediately after passing general surgery. So if I fail general surgery, then the dream will be gone. So what I thought was, somehow I have to pass general surgery, and most of the, in our college, practical exam is the one which will matter most. So that's why in practical, all these cancers, breast cancer, thyroid cancer, and this colorectal cancer, rectal cancer, these are the cases which are going to be put. So I wanted to have maximum knowledge in that. So I joined Speed, general surgery and surgical oncology to get a huge knowledge about this. And for passing general surgery at any cost, I doesn't want to take risk that if I fail, my 1 year of life will be gone, and I will be waiting another 1 year to enter into this branch. So I took surgery only to enter into CVTS. That is the reason I just doesn't want to take risk, and speed helped me a lot in that. And probably most of the questions what they asked was told in speed itself in surgical oncology. And once I wrote the exam, once I felt like I will be passed, immediately I paid extra 10,000 and took CVTS branch as a next coaching classes. Immediately started listening CVTS classes for 1 month. In 1 month, I made small notes and just revised it before the exam. One more thing I want to share you, sir. My batchmate is also interested in CVTS. She didn't join speed at all. But just before the exam, she just asked me, I have not read anything, what to do. I don't know whether I will qualify or not. So I just took her and I just discussed with her the notes, whatever I did. You believe it or not, not even single word she read for cardiothoracic surgery, and she got 110 rank. Just whatever notes I made by seeing the speed coaching. This is what is the effect of speed on all of us.
And cardiothoracic surgery, I'll tell you, there will be, if from now on, after 3 years, there is something called fear factor, na? That will not be there. When you have done your MSL surgery,
Yes, sir.
even for hemorrhoid, you'll keep on buzzing till the last drop of blood, and you keep on packing.
Correct,
And
sir.
whenever there is little more boost also, you will be very much worried. What is this bleeding? You come to this part of the career. After you do surgery for a hemorrhoid, you will allow, don't even pack, and you will come. I will tell you, see, I will tell you to intubate, to to do a central line, to do a sternotomy, bedside, to reopen. See, that kind, cardiothoracic surgery is both medicine and surgery. It's a great
Correct,
specialty. It is nothing like that. It is nothing like a thrill that you wanted in life. Yes.
I heard this. I had heard this same sentence telling you in a class, sir, right?
I will tell you, you will not regret. You will feel top of the world. You will feel the real king and the team leader. And you will have that feeling. And no worries. And you will definitely enjoy your career. I will tell you that much. Very much clear that.
Yes, sir. Yes.
I will tell you one more thing. I'll just tell you this with you. It's a forum, but I'm sharing this. Any corporate hospital or any big hospital or any medical college hospital, if the cardiothoracic surgery and cardiology department are good, I'm repeating this. If
Yes,
this cardiothoracic surgery surgeons and the team is good and the team of cardiologists is good, that hospital can do wonders. Any other
correct,
specialty can do any work boldly without any fear that there are people to take care of us from any eventuality. And only those hospitals will flourish, will grow big, and that will be renowned. So the entire
correct.
working and functionality and progress of the hospitals, or either be a government or be a private, any sector, small size, mid size, big size, it depends on the department of cardiothoracic surgery and cardiology. So,
Correct.
and to build any big institution like this is the base. So you will be always the base of any institution. You mark my words. After 5 years, 10 years from now, you will be sitting as one of the bases in one of the big institutions that will come up wherever you
Yes,
practice.
Sir. Yes, sir. Yes, sir.
Yes.
Yes, sir.
So my wholehearted wishes,
Thank you very much.
not only for this exam and you joining a team of cardiothoracic surgeons, and I wish come and join the club, and you will always feel very much privileged and happy. And God bless you for all your endeavors and efforts.
Yeah.
Keep going.
Thank you very much, sir.
Thank you very much. All the best.
Thank you, sir. Thank you.